casual. Okay. Thank you. Everyone has to click on that if they would like to be recorded. We post these online because people like to see them afterwards. And it's good for organizing purposes. The Ontario Health Coalition is holding these town hall meetings across the province because, as I'm sure anybody who's paying attention to the news knows, we're facing a truly unprecedented crisis in our hospitals, and certainly no less so in Chesley. All across Ontario, we are short of staffing and emergencies are closing. And this has been a crisis for a long time coming. So what I'm going to do is just basically give a little bit of an introduction. Then we're going to have a more concrete discussion about Chesley's situation, open up the floor for discussion, and then we have some suggestions from the provincial level, what can be done. And I'm sure that something will come out of the discussion on what can be done locally too. So this crisis that we've reached is actually totally unacceptable. Every larger hospital in the province is running at close to 100% capacity, which means there's no beds. Often they're higher than that. Their beds are all full. Patients are waiting in stretchers, in hallways, in lounges, in every available space. They're just waiting for a bed.
Reading between the lines, 6 former staffers at the pro-democracy newspaper asked Bailey guilty.
Sorry, Ross, just a second. You're just muted.
There we go. Okay, got it. Okay, so these backed up emergency departments, they're backed up because the beds are full, and often paramedics and ambulances have to wait for hours because there's no staff to offload their patients to the beds in the hospital. And often there's a shortage of ambulances, especially in rural communities. Like in our community, South Frontenac, we've had a continual shortage because all the hospitals are tied up in Kingston. Ottawa has the same, and I don't know if it's happening in Chesley, but I would love to hear that how your situation's working. And really, none of this should be a surprise. Across Ontario, we have the fewest hospital beds per person of any province in Canada. So, and Canada as a whole is almost at the bottom of every developed country in the number of hospital beds. In other words, Ontario is the lowest of the low. So when you're running that low in terms of the number of beds that we're providing, it's no wonder that we have a crisis in our hospitals. And smaller hospitals are in the most trouble. Governments have forced downsizing. Local services have been cut. They've been closed. They've been centralized to other larger hospitals or rationed between multiple sites. Patients now have to drive to one hospital for rehabilitation, another one across the county for palliative care, a different one for birthing and surgeries and tests, and so on. And when the Ford government says that money won't make any difference, that's just totally untrue. Just like the number of beds, the fact is that Ontario funds our hospitals at the lowest rate of any province in Canada. And this has been done on purpose to force them to downsize and ration their services. When the Ford government was elected in 2018, they cut the hospital funding formula to less than the rate of inflation. This continued until the pandemic hit. And this year, the provincial hospital budget is not only less than inflation, but there's a real dollar cut from last year. So the actual funding for hospitals in Ontario is going down. So when we headed into the pandemic, we had no surge capacity, and surge capacity is important because whenever I used to work in emergency, and whenever you get a crisis, whether it's an accident or a pandemic or anything, you need to have you have to be capable in your hospital of taking that crowd. So usually you should be running around 85%, and we're running around 100% in most hospitals. So we have no surge capacity. And that has burned out hospitals and staff, and the remaining resilience in hospitals has left. Staff have begun to leave in significant numbers. we now have a severe staffing shortage. In the summer and into this fall in Chesley, as I'm sure you know, and across the province, we saw hospitals close their emergency departments and ICUs. They closed beds in birthing units and other services because they couldn't staff them. This is absolutely unprecedented. There have been almost 100 temporary emergency department closures since the summer. That's in the last 4 months. And Chesley is one of the hardest hit local hospitals. Two aspects of this crisis are staggering to the Ontario Health Coalition, and I'm going to say us. The first is that most of these problems, including the staffing crisis, have been forecast for years, and yet nothing was done by any governments. They've been projected in study after study, and now it's hit. We've hit that wall. And the second one is that now that we've hit that forecasted wall, how little the provincial government is doing to resolve the crisis. In fact, they're continuing to say there isn't a crisis, and yet any patient, any relative of a patient, or anybody who's paying attention to the news knows that there is a crisis. And the temporary closing of an emergency is serious in itself, but it raises the real possibility of hospitals being downgraded to urgent care centers, which is really just a fancy name for a walk-in clinic. There's no legal category for urgent care centers in Ontario. It doesn't mean they provide any particular services. They just become a walk-in clinic. And the closing of emergencies threatens the local laboratory and diagnostic services, which are required in a hospital. So when you have a legitimate hospital, you have to have diagnostic and laboratory services in your community. And when you don't, they don't have to be there. And of course, for funding reasons, they quickly disappear. The closing of emergencies, the closing of hospitals threatens the ability to retain community doctors and other healthcare staff, and it threatens the viability of the hospital itself. The solutions that governments too easily choose are often to bring in more private for-profit surgical centers, laboratories, diagnostic centers, hospitals, home care companies, and private nursing homes. These are solutions that only weaken the public system and cost taxpayers and patients more. This lack of commitment to maintaining and improving our public nonprofit healthcare system is central to the problems faced by communities across Ontario. We need a commitment to maintaining small town hospitals. The government should just make that commitment and start to work on making it happen rather than thinking of other ways to undercut the system. These hospitals were built by our communities, they are maintained by the community, and they are an essential service for any thriving community. So this is sort of the general state of healthcare. We could go into a lot more detail, but I think that gives an overview from the Ontario Health Coalition perspective. And we're hoping that these series of town hall meetings we're holding in many communities across the country will help, across the province will help start the Fight Back campaign to say that no, we have to rebuild our, improve, maintain and rebuild our public healthcare system. So now I'd like to turn it over to Angela Priocannon, who's been a nurse for 31 years, and she's the first vice president of the Ontario Nurses Association. And they've been working with nurses at the Chesley Hospital to advocate for solutions that would address the emergency department crisis. So Angela?
Thank you, Ross. Hello, everyone. And I want to thank you and the Ontario Health Coalition for organizing this important town hall. My name is Angela Priocannon, and I'm a proud RN and the first vice president of the Ontario Nurses Association. ONA represents over 68,000 nurses and healthcare professionals across the province, including 18,000 nursing students. I'm grateful to be here today with you and have the opportunity to share what is happening in our healthcare system now and why we know privatization is not the answer. At this point, anyone who's paying attention has heard it before. Our nurses and healthcare professionals have been stretched beyond the breaking point. We've been in crisis mode for almost 3 years now. At some point, it's not a crisis anymore. It is the new reality. And I think we all know that this cannot be our new reality. We know from the new Canadian Health Institute for Health Information data that Ontario has the worst in the country when it comes to RNs per capita. Across Canada, there are 830 RNs per 100,000 people. But in Ontario, as Ross had noted in his comments, we are the bottom of the barrel. We just have 668 RNs for 100,000 people. That means just to be at the Canadian average, Ontario needs to hire almost 25,000 RNs immediately. What does a staffing shortage of this magnitude look like in practice? It's become commonplace for nurses to be kept at the hospital for hours after their shift is supposed to end because the next shift is short-staffed and it's not possible to safely transfer patient care. We have nurses working on maternity floors that should have 35 RNs on shift, but the new normal is to have 17 or 18. We have hospitals where there are more vacant RN positions than there are RNs on staff. In Chesley, we know the emergency department is closed indefinitely from 5 p.m. to 7 a.m., and this frequently is extended for 48 to 72 hours. On top of that, in Walkerton, Durham, and in Kincardine, we are seeing sporadic ER closures because of the staffing shortage. We are seeing some departments down to just 2 part-time RNs available for the entire department. The increased strain of COVID-19, RSV, and the flu, these ERs are being overwhelmed with home and community care patients who are underserviced or completely underserviced and have nowhere to go but the ER to get the care that they should be getting at home. Nurses are telling the employer what they need to do to address the staffing shortage. Better pay for overtime, mileage for travel between sites, pay incentives for picking up those weekends and evening shifts. There's been no response and the crisis continues. We know that nurses are resilient and resourceful. We always put patient care first. Even in the most extreme difficult times, our members find a way to provide the care that they know all patients need and deserve. But the cost of this burden is taking its toll. Early retirements are going up. New grads are rethinking their careers and leaving only after 1 or 2 years on the job. Nurses are leaving to work at private agencies where they can ensure they have a work-life balance. There's a real cost to our healthcare system, and the situation worsens. And now the full picture is coming into view. The Ford government is setting the stage to use this crisis to justify their privatization agenda. Ford took an understaffed system and made it so much worse by introducing Bill 124, which caps the wages of many nurses and healthcare professionals, violating our charter rights. And Ford is refusing to work with healthcare professionals to invest and implement a meaningful retention and recruitment plan, leaving our system severely understaffed with no relief in sight. Now, Ford is using this crisis, which he has created, to push his plan to privatize our healthcare. Across the country, Canadians pride themselves on our world-class universal healthcare system. We believe access to healthcare should be based on your needs and not your bank account. Nurses and healthcare workers are strong advocates for public, non-profit healthcare because we know the devastating impacts of privatization. The most broken parts of our healthcare system are the ones that are already privatized, like long-term care and home care. Private healthcare will take away from the public care by pulling resources and staff from the public system. As nurses, we have already seen this as colleagues have left the public system to go work for private agencies. And we can't blame the nurses who make that choice. The agencies let nurses choose their own hours and pay more because conveniently enough, they are not subject to Bill 124. But there is a serious cost. Those agencies charge outrageous prices to public hospitals. They don't provide pensions, benefits, sick days for their nurses. This undermines nursing as a stable career and undermines our healthcare system by siphoning off precious dollars to line corporate pockets. This will impact access to quality care and will hurt patients who can't afford to pay. We can't let this happen. Ontario's public health system is not Doug Ford's to dismantle and sell off to his corporate buddies. Our public healthcare system has to be built up over generations and belongs to all of us. That's why the Ontario Nurses Association is here with you tonight, and we will continue to work hand in hand with our allies to fight in the investments we need for our public health system so that everyone gets the care they need and deserve. Together, we can stop Doug Ford's plan in his tracks. I thank you very much for letting me speak tonight.
Thanks, Angela. I think at this point, rather than us to continue speaking, I would love to open this up to anybody who's got questions or comments. So what's going on in Chesley? Any specific concerns? Any comments for us? That would be very helpful. The way to I mean, if you want to speak, we can just do that, but it's probably better if you click on the thing called reactions at the bottom of your screen. Something called reactions. When you click on reactions, it says raise hand. And I'll just do that and you'll see it puts a hand. I should have a hand wherever I am. I don't even know where I am. There we are. There we are. And then I'll just know it and you can speak. Is there anybody who wants to start off here? Carol?
Hi, thanks very much, Ross. Lovely to see you, by the way.
Yes, I thought it must be you. Carol used to just
It
live
is.
down the road, not too far down the road from me in South Frontenac.
That's right. And Angela, it's absolutely wonderful to see Ona at the session tonight. I was a president of the Ontario Nurses Association at Sunnybrook for many years and also a staff member. So I'm glad to hear that Ona is here tonight speaking. I also want, the public will know, many of the community members will know that I'm the person that was hired by the municipality of Brockton in January to do a report on why the Walkerton Emergency Department was closed. And I interviewed over 140 community members and nurses. And the response was, quite frankly, overwhelming. The stories were heartbreaking. And in this particular community, this is a place where there are 4 sites to 1 hospital. And this is a community that supports this hospital 150%. And it is very sad and very disappointing to see how this hospital is letting its community down. It's important to note that there are other community hospitals in our area that have managed to keep their emergency departments open, including the hospital in Owen Sound with its, I think, 7 sites, including up in Lions Head, where despite all the distance and the fact that it is a very rural and isolated site, they continue to be able to keep their emergency department open. And the Hanover District Hospital, which is not far from Walkerton and has been taking a lot of the load for the work as a result of Chesley and intermittently Walkerton closing, and also Durham. So it's been very disappointing. There are some real problems within this organization that the board refuses to address. This is not just about the nursing shortage, and this is not just about COVID. This is about a community hospital that refuses to get into 2022 and actually address the issues of the nurses and become proactive rather than reactive. So this is a place where nurses told me, despite the fact they were retired, they were willing, if a colleague called them at 3 in the morning and asked them to come in to emerge to work, they would come in unpaid and help their colleagues. This is a very, very difficult setting, but this is a community that's very tight. And Doug Ford and Lisa Thompson, our member of provincial parliament, and our federal member, they all pretend that this is about the nursing shortage, but a lot of this is not about that. But what has happened, and I think we have to focus on that tonight, is that we are privatizing. We have unbelievable usage of agency nurses up here. And to me, that's privatizing healthcare. These are private for-profit companies coming in and hiring RNs to work in the emergency departments and paying unbelievable amounts of money. And I have actually had the good fortune of being a patient in the emergency department in Walkerton, where the very senior nurses looked after me and guided and mentored the agency nurse who was looking after me. And despite the fact he was making far more money than them, they were and 50% professional. They supported him, they mentored him, they continued to coach him about the things he needed to do. And it was clear he was not capable of working in that emergency department, but they were glad for the help and they supported him. Now, I also have to tell you, I overheard he was leaving that hospital after working 12 hours and driving to Newmarket to work another 10 hours in the Newmarket emergency that night. And yet that's what our hospital has said, our CEO and board have said is the answer to the problems here. Yet I have had nurses who asked for very reasonable leaves for very tragic and sad situations in their lives where they asked for a week off and the employer said no. And they resigned. I spoke to nurses who applied to work in Kincardine because they had a partner who was a physician in Kincardine, and they were told, no, you have to go work in Chesley. So they went to Godrich. So this is, I will not say this isn't about a nursing shortage. I will not say this is not about the fallout of COVID and the absolute overuse. Our nurses were burnt out before we got into COVID. They rallied, they did fantastic things to get through COVID. But now they're absolutely disheartened. And the reality is, and there was a meeting not too long ago in Chesley on October 18th, where people stood up and said, what are you doing to keep our nurses? Because nurses are leaving, not because they can't do it anymore, because they're not appreciated for what they do. So of course, ONA should be fighting to get this draconian 1% salary. This is a slap in the face of nurses. We need to address that. But we also need to be addressing governance in these hospitals where they're not running the hospitals properly. These boards and senior management need to be held accountable by the Ontario Health, and our problem is they're not being held accountable. And so nurses are fed up, and you've finally beaten them down and they're leaving in this area. So thank you very much for that opportunity to speak, but I did present these results to the municipality of Brockton. I presented them to the municipality of Erin Eldersley, which is also where Chesley Hospital is. And I did present them to the county of Bruce. And all of these areas, I was very honest about what the issues are. And yet, despite our meetings and pleas with the Minister of Agriculture, who is our member of provincial parliament, we have not been able to get this message through that this is a hospital that is mismanaged and they're hiding behind COVID and the nursing shortage.
Right. Thank you, Carol. No, we hear that disrespect all across the province. Leanne? And it's not just for nurses, it's for all the healthcare workers. Leanne? Leanne Fisher? Do you mind if I just go to Bryn there, Angela, before we come back? Bryn? Unmute yourself. We'll maybe come back to Leanne in a second. Bottom left. Microphone, just click on it. Carly, can you oh, there
Hello?
you go. You got it. Yep. Okay, that's good.
All right. Some very interesting points being made here this evening. And so I'd like to just start with one comment. Do I see anyone on this screen who is a member of our local municipal council? Our mayor, anybody taking an interest in this? I guess from looking at everybody's names, my guess is no. And that's disappointing. After the October 18th meeting, I was really intrigued by the whole, well, a number of issues, but one of them was the whole issue around Bill 124. One of the unions took the government to court about Bill 124, and it went to the Supreme Court, and they finished taking testimony on September 23rd with a stunning lack of response since that time. So they could, depending on what their decision is, they could have eased some of the problem. And they are apparently choosing not to. That's 2 months now that they've had the testimony and that they have done nothing. So I think that's another little bit of an issue. Certainly the privatization issue is huge. And I really welcome ONA here. This is a community issue that affects more than nurses, although a huge, oh, there we go. Although it's a huge issue for them. Are the other unions, have they been approached? Are they willing to support movement to oppose these privatization? Are they actively involved? It's just a question I'll put out there. Sorry.
That's
My
okay.
camera's
Ian, I
going
think
up
we're
and
doing
down.
okay there, Ian.
Okay. I'm not a great techie person.
Okay.
I'm the mouthpiece.
We can see you just fine there, Bryn.
All right. So that was a couple of points that I wanted to make. After October 18th, I put a few of my thoughts out there in the community through Facebook and a few other options. And I had an opportunity to speak with a couple of nurses who aren't online tonight, but who have left Chesley Hospital. And one of them I found very articulate. She said she knows that there are at least 5 of the nurses who resigned who left because of management issues that were never addressed. And they didn't, they said that, if someone would address these issues, they would certainly consider returning. So I think we're right. There's something here at the board and management level that isn't being properly addressed. I don't know. I find it interesting that every time we have an election, we get to vote for the people that sit on the Board of Education, but we don't even know who's on the board of the hospital. I think when we had the meeting, someone said, oh, there's a number of them in the room. Nobody stood up and made claim to that, like I'm one of them. So I know the name of one of them. That's it. So we don't even know who is responsible locally for these things. Anyways, I really welcome what you're doing. I hope we can develop some kind of action plan going forward and build some kind of support for this extremely important issue.
Can I just
Just
ask
a
you
little
really quick?
personal note. Oh, just a little personal note. When the Conservatives, oh gosh, what year was that? I'm going back about 30 years. They tried to close the Chesley Hospital. My mother was one of the people that really came forward with a letter writing campaign, and she and the people she worked with helped then to save the hospital. So that's just personal.
Is there an
Thank you.
organization now that's working on a community level in Chesley?
Not that I know of. I mean,
If anybody's
anyone's
interested,
willing,
maybe they could just write a note in the column in the chat thing and we could get a hold of you later. Angela? If you're interested in helping with set one up. Yeah, Angela?
Thanks, Ross. I'd like to recognize Carol. I remember you, Carol, from many provincial coordinators meeting. I have been active a long time within ONA. So thank you for your comments. And I do remember you being a staunch advocate for patient advocacy, patient care. And so thank you very much for your comments. From the ONA perspective,
We just let you just got yourself turned off there, Angela.
oh,
There you
sorry.
go.
From the ONA perspective, we work tirelessly at fighting the government and their archaic ways. We did have quite a active election platform happening. And as you all know, Doug Ford was elected with a very small minority of voters voting, worst voter turnout, and yet he still managed to get in. Shocking. And we are currently in a big campaign with St. Mary's Hospital, the Huron-Perth Health Alliance, who have decided that it was better to close their emergency department overnight, rather than allow nurses who wanted to go to a casual status. They were looking to continue their service with St. Mary's in a casual status, and the emergency department refused. The management refused to let this happen, which has now in turn caused such a severe shortage. They can't keep that emergency room open most weekends in the summer, this past summer. So I am actually meeting with their board on December the 1st with a number of the nurses who were affected to have a story told to their board, because we don't believe that their board actually knows that the hospital refused this.
Mhm.
And we don't believe that the hospital has been forthcoming with their plans. Now, interestingly enough, the hospital did come forward and say, well, we'll provide some casual positions for registered nurses, but in every department except for the emergency department. So it's very, very interesting, the games that employers play in order to make their point. So I would be happy, as part of my portfolio's political action, I would be happy at any time to organize a group from the Ontario Nurses Association to come out to Chesley. And if you need a picket, an information picket, or any kind of political action, we are there to support you and to help you.
Sounds
So-
like it might be worth going to the board here too.
That's right.
Oh, good. That's interesting. Thank you. Leanna Fisher,
Yes, sir.
there you go. Great. Thank you
Okay.
there.
It's myself and my husband, Sean.
Okay, great.
I'm not a resident of Chesley. I'm a resident of Brampton. I have family that live in Chesley. Chesley is reopening their doors actually as an urgent care center. They're going to be open from 7 a.m. to 5 p.m. We
Monday to
have
Friday.
that. We have that here in Brampton. And here in Brampton, it works well because the Brampton Civic Hospital is the busiest hospital in Ontario. So if you want to go to hospital, you go to the urgent care. You don't go to Brampton Civic. But anyways, the lady that spoke earlier saying her mother went on a writing campaign to keep the doors of the Chesley Hospital open, I think she should reach out to Nathan Rohde. Nathan Rohde's the funeral director in town,
Yes.
and he stands behind that hospital. If you want someone on your side to fight with you, he's the man to go to.
Well, that's a helpful bit of information.
Okay, my husband wants to speak also.
Okay.
Sorry. I unfortunately became a diabetic 53 years ago at the age of 6. So I've been through the health system multiple times. So the first thing I wanted to do is a huge thank you to the nurses for being the backbone of the medical system. It's no disrespect to the doctors, but the nurses, not the doctors, have saved my life more than once. So that's number one. Number two, I believe, and I don't know whether it's true or not, that when nurses are going through the schooling, they are marked on a bell curve, which to me reduces the number of available nurses. I don't know if that's true, but if it is, remove the bell curve at least temporarily to allow more nurses into the system. And third, finance-wise, if they would if they're not gonna do it with a salary, put an incentive in for nurses for 12 months at a time to work in the rural communities, to give them the, I don't even know word I'm gonna use, the initiative that they wanna go to these smaller places. The crock that the whole thing is about nurses, and that's, sorry, it's a crock. It may be partially true, not completely.
They need to hire them full-time, not give them.
And
4
not,
hours a day.
and not part-time hours.
Thank
That's
you.
another, yeah, not part, it's gotta be full-time hours. If the bell curve's there, reduce it and give them an incentive for going to the rural communities.
Good idea. Thank you. Sonia Tomlinson, did you have something to say? Then we'll get Riley to talk about some provincial stuff that the coalition's doing. Sonia? You had your hand up a second ago. That's why I was asking. Okay. Well, if you wanted to say something in a minute. Did you want to say something, Sonia?
Okay, yes.
Okay,
No,
great.
I'm no politician, but I have been in management for many years. And if there is a mismanagement going on in the hospitals, for whatever reason, how do we solve that? If the board is ineffective, then that board needs to be addressed, removed, or whatever it takes. But just continuing to look at things and let them slide down the hill does not help anybody.
Mhm.
We're mostly a retired community here in Chesley, and we use that hospital. I depend on it. I have many ailments, and I depend on it. It's always closed when I need it. And that's, to me, is not sufficient. I know of many people here who've told me that they support the hospital very heavily. And I mean, we support our hospital. We're behind it 110%. Why is it we are left out into the cold? Because management is ineffective. I
Mhm.
think that needs to be addressed. And if we can start there, perhaps we can then rebuild our hospital.
Thank you. I think I'm going to get Riley to speak just for a second. And then I will come back and see if there's something we can do to get a Chesley patient citizens group going. Riley is the Saunders is the communications and organizing director for the Ontario Health Coalition. He's just going to talk about the provincial campaign, which will help a little bit because part of this is getting more money and a better response from the provincial government, but also sounds like you've got some local issues that need to be dealt with too. Riley?
Thanks, Ross. And as Ross said, this is one of the town halls that are happening across Ontario. So this campaign is meant to help smaller rural communities like Chesley, but it is happening across the province, just like the crisis is happening across the province. So there are ways that you can get involved in your community and across the province as well. So I'm just putting a link in the chat. So if you click the little speech bubble that says chat at the bottom of your screen, you'll see that I sent a link that's www.ontariohealthcoalition.ca. So you can either click that or you can enter that into your web browser and it will bring you to our website. And if you should be able to see my screen right now, and this is our home page for the Ontario Health Coalition. Can everyone see that okay?
Mm-hmm. Yep.
So when you type it in ontariohealthcoalition.ca, I will bring up our homepage. And right in the middle of our homepage, you'll see that there's a campaign here that says Defend Our Public Health Care. From this page, you can sign up. So you can fill in your information here. The ones with the red stars, they are required. It won't let you get past this screen without filling them in. Then you would click Finish. When that happens, we'll send you an email with a little bit more information about how to get involved. We'll also, if you say yes to this question here, we'll also keep you updated on anything that's happening either in your community or across the province that you can get involved in. If you're also able to share it, if you want to share this to a friend or family member, if you want to share it on Facebook, you can just click this F here and it will bring you up a post in your Facebook, and you can write really important, sign up today to defend public Medicare, and then just hit post and it will go right to your Facebook. If anyone has Twitter, they can hit the bird here and it will create a tweet for you as well. So once you sign up for this, we're expecting Medicare defenders across the province to sign up. And by signing up, there's 3 things that you can do. The first thing is that we've created a leaflet, and this leaflet has the threat of privatization and how you can get involved and how you can advocate for better public funding and to fix the crisis in our public hospitals. So what you can do is it will bring it up and you can print it out, or if there's a group of you, maybe you can take it to a print shop and print it in a group to save some money. And you can take it door to door, or you can put it up in your church or put it up at your work bulletin board, or just hand it out to your neighbors or any social event that you have. So that's the first thing that you can do. And I'll show you what they look like in just a second. The second thing that you can do is we're asking that people fill in surveys. And what these surveys are is they're asking for people to testify that they have had to pay for healthcare. So if that means that you've had to pay for a cataract surgery or a hernia surgery or any kind of healthcare at all, fill in the survey so that we can keep track of it. Because as you guys know, the Ford government is saying, oh, it doesn't matter if we privatize healthcare because you'll pay with your OHIP card. And we know that that's not true. We know that we are already seeing people paying hundreds or thousands of dollars for cataract surgery. We're seeing them paying for extra things that they don't need at colonoscopy or endoscopy clinics. So we're asking for people to fill in a survey to testify that they have had to pay. And the last thing is that we're asking people to promote and attend local protests. So as this campaign gets going, and we've just released the first batch of town halls, there are going to be building to local protests across the province. So all that information will be available here. So if you're on this page, you can click the red here button, and that will bring you to this page. This page will have the leaflet here. So you can just click it and it will pop up like this. So you can see the campaign information and you can print it. Oops. Sorry about that. You can print it and then fold along the dotted line and distribute it as well. So that is the leaflet. If you scroll down a little bit more, you will see the survey. So it'll give you some instructions, some examples, and then you can click here. And this will give you the information and the questions. So if you fill it out, we can use this to push back against the messaging, as well as potentially fight back against the private clinics that are charging these charges as well. So you can fill and print this out. You can email it to us. Our email address is ohc@simpatico.ca. I'll also put that in the chat just right now. So you should see that in the chat as well.
Okay.
And if you scroll down here too, we will be posting any information about local protests once we have it. So you guys are one of the few, you folks are one of the first town halls that we're having. There's going to be much more in the next couple of weeks. And from that, we're going to be building for protests. And I think Bren was asking if there's other unions that are involved or are willing to push back against privatization. And the answer to that is absolutely. We've had support from almost every major union and all of the healthcare unions. So we are going to be seeing support. And we are going to be having a large-scale protests as well. Does anyone have any questions about how to sign up or what they can do here? This is just the very first things that we can do here as well.
Okay. If you do, you can write them in the chat box or just put yourself on the list and we'll ask them. Before we go to Hazel, who is next here, I just want to say that the Health Coalition has worked with local community groups to save ERs in Wallaceburg, St. Joseph Island, Welland, and other places in different departments. So we've got some experience at doing this and we've had some successes. So if you're interested, if you could email at ohc@simpatico.ca and just send us your name, that's one way to get information without becoming public. And we could talk to you about what that would mean and how we would go about that. If you feel a little more confident, you could just put your name in the chat box there and we could just get back to you also. Either way, we'd be happy to talk with people. I think that sounds like you need to have a local group there, which is fighting to protect your hospital and make it work better. Hazel, Pratt?
Yeah, thank you, Ross. I just have a few comments from some of the things that were raised. I did put in the chat that I belong to the Graybers Labor Council, and we represent a great variety of workers that are unionized and workers that are not unionized in Grey and Bruce. And certainly we've been there with healthcare workers, and the latest fight with the government is for education workers. And so on the subject of the whole Bill 124, I do know that many, as Riley said, many of the healthcare and other unions have been pushing to have that bill repealed. As well, I believe the Ontario Health Coalition's been at the table and the opposition parties, and nothing has come of that. At the October meeting that I was at the community, at the Chesley Community Center, and really amazing turnout and great people up at the mic. There was the chair of the board, and I don't think he said that there was anybody there, but I looked up on my phone who were the board members, and one of them, who had just been appointed in the spring, so months earlier, was standing at the back of the room and, didn't make his himself known. And I found out that one of the board members is my neighbor. I have never heard from her or seen her around or anything. And some of these people were just recently appointed and are not appointed to any committees. And some of these board members have been on it since the 90s, and what are they doing? We don't hear from them. They mustn't be doing anything. And just as someone previously said, we elect our school trustees. We need to be electing these people that sit on our hospital boards, because we hear nothing from them except the board chair who was at the meeting. The town of Chesley and surrounding area really gets out and supports their town facilities, whether it's the hospital, the high school, which is no longer. But you need these things. People don't want to move to an area, and it does not do anything for economic development of a community. It kills it if you don't have schools, hospitals, doctors, policing, all of those things people look for when they move to a community, or if there's going to be a business moving to the community. So this lack of support from government levels and from the board, like it's just totally being mismanaged, because they're just affecting our communities surrounding the hospitals in this corporation. And the hospital is essential for our older population that you know, that transportation is not something that we have in the area. And we have a very large Amish community. And so Chesley's a real main place for them to come for doctors, which we've had amazing doctors. And I mean, you're not going to have any doctors if we don't keep our emerge. And I think that's all I really had to say was about especially about the board. So,
Thank you.
Thank you.
I'm just going to take the people who haven't spoken, Carol, and then we'll come back to that. Andrew, there's only one person there at this point. Andrew?
Right, thank you. I just wanted to say there is a very loosely organized sort of community group or a group of concerned citizens out of the sort of associated with the Kinsman Club at Chesley. So, and Nathan Rohde is one of those people. So if you have a contact for him, he would be likely the go-to person for that. If you're looking for some sort of group that is going to show up at a protest, that's likely the go-to group in the area. I actually asked David Barrett to come out to a Kinsman meeting. It was last week or the week before. And so he did attend, which was surprising. And he took a number of questions and gave us more time than I was anticipating he would. But what I took from it was that he, in effect, will be engaging the agency nurses more. And so engaging the privatization more because he feels that that's all he can do. And he is unable to provide any idea of what his planning was leading up to this in the years leading up, or what it is now for retention of nurses, or actively drawing nurses in. I mean, at the conversation, there was, you know, at our meeting, there was a discussion about, well, what, I mean, could the Kinsman be, you know, basically trying to, you know, have some sort of financial incentive that we could offer, which seems like an absolute Hail Mary move, and not particularly well thought out on his part. And so really, I recognize what your issue is, which is a provincial issue of absolutely inadequate funding for years as a result of a conservative government, which is interested specifically in privatization. So it's a tool for them to strip it and then make it privatized or allow it to become privatized. But what you've got in this area is a board that is completely made up of wet rags. David Barrett, as I understand it, totally buggered up the whole system. His role as the director of the Southwest Lynn did a particularly awful job, and then does a lateral over here. He's unable to provide any plan. Anybody that was at the meeting in Chesley said would be able to tell you there was no transparency as to what the game plan is or how he was planning for any of this problems, which were clear, and how he's moving forward. There's nothing there. The other comments about the board members, I mean, there were just no shows at the meeting. There are no shows at this meeting. And so the acute problem here is our board. We've got the same problem that everybody else has with a conservative government, but our board is the problem here. And we could use direction, I think, as a community as to how we can put very specific pressure on the board. You know, I've looked at the bylaws. I think they're up to date. Everybody's, you know, serving their terms. Some of them may have been there from the 90s, but they're allowed to be there, and nobody in particular is running against them. So there needs to be some support there, and perhaps your organization can help, but the immediate problem here is the board. The comments about the other hospitals, I mean, Tobermory is able to stay open and we're not, makes no sense. And as I understand it, I'm not the expert, but a number of the nurses in Chesley are required to be signed on for multiple sites, which is also a problem. And so, you know, I don't know how we can deal with that, but this is a board level problem. That is the immediate problem. So, you know, I'm not sure what your scope is, but certainly some assistance in relation to that specific issue. The board level issue is what we need to keep our hospital open. And he also seemed quite happy, you know, an emerge that's open for, you know, 9 to 5, 5 days a week. He was pretty clear, better than nothing, and sure. But, you know, it seemed fairly clear that we weren't going to be doing any better than that.
Yeah. Well, I would just two quick comments. One is I would suggest that you and maybe Angela can follow up. You know, I think that visiting your board from the staff, from the nurses' perspective, and talking about what's happening and all these issues and raising it directly with the board might help. So I think that's useful. The other comment I wanted to make is I just want to reinforce how much more expensive agency nurses are than using regular nurses. It's sort of a shocking amount. I don't know what it is now. It's been a while since I worked in a hospital. I've been retired for 8 years, but it will be 2 to 3 times the hourly pay of a regular nurse. It's a shocking amount of money. And, that's partially a question to take to your MPP. And I think you can take the board question to the MPP too, because they have access to Ontario Health.
Well, and I think
it is a process though. You're right.
That is part of the problem, because what we've got is a new MPP, and I'm sure he's a nice guy. But he also came, and he also came to that meeting, and it was a weird campaign speech. I mean, I don't think he's particularly well versed with Bill 124. I don't think he's particularly well versed with the legislature. I mean, he's fresh. He's a fresh-faced guy that doesn't know what he's doing. And so, putting pressure on him would also be helpful. So, I mean, if you guys want to be effective in our area, you need to put pressure on Mike Barrett, and you need to put pressure on Byers specifically.
Great, thank you. Yeah, Angela, did you want to say something? We'll go to Carol.
Yes, I did. As far as agency nurses go, and thank you, Andrew, for that information. And please, if I can put my email address into the chat, and if you want to reach out to me, we can talk about some strategy for some political action at your for you. But agency nursing, to put things in perspective, it is anywhere between $85 and $125 an hour that the nurse is being compensated. That is not what the agency is charging the actual hospital. And we have to remember something. It's not the nurses that are the ones that are the guilty party here. It's the agencies and the government that allow for this to happen. Often I'll hear that agency nurses are taking over, but it's the agencies that are taking over, not the nurses.
Mm-hmm.
Having said that, UHN, University Health Network in Toronto, has a budget around $1 million a year that they put as a agency nurse fund. Their fiscal year ends at the end of April. Sorry, at the beginning, end of March. And in September, from April 1 to middle of September, they had spent $6.7 million in agency nursing. Sunnybrook has spent $8.2 million in agency nursing. So that's what this is costing our system. If the government would look at reevaluating and putting those funds and resources back into nursing that is currently in the system, it would be a different ballgame. But they're using Bill 124, which we are coming out of that 3-year period now, and we're going into bargaining in January. Repealing Bill 124 would be ideal. Do we think it's going to happen? Of course not. It was the peer pressure of everyone coming together on November the 1st and the rally in front of the Ministry of Labor, downtown Toronto, that pushed the government to, kind of be forced with all of the unions coming together and doing that big protest at Queen's Park the following Friday that made them repeal Bill 28. So stay tuned. All we can do is fight, fight, fight. And that means all of us. And I'm absolutely happy to come out at any time and help with any rallies or protests that you're wanting to do for your community.
Thank you, Carol. And then I'm going to suggest that we try and wrap up at about 15 minutes. So if other people want to say something,
I do.
I can see, Brent, I've got you there. Don't worry. I'm
Okay.
going to get people to speak. I just want to make sure everybody who hasn't spoken also has a chance to speak. Carol, and then Brent.
Do you hear me?
Yeah.
Okay, so there are 2 groups that have been fairly active since January. So to remember that this is one hospital with 4 sites, right? There's the Chesley site, the Walkerton site, the Durham site, and the Kincardine site. There is a group called the Friends of Walkerton and Chesley Hospital, which has been active. They have about 650 members. They've been fairly active. They pushed Lisa Thompson, our member of provincial parliament, hard. And I believe that's why both Walkerton and Chesley opened just prior to the election. There was going to be a meet the candidates night talking about healthcare. And all of a sudden the hospital was able to open up their emergency departments. So that's a quite active group. There's another group called Friends of the Kincardine Hospital and Nurses and Staff, who also are very active. They have 600 or 700 members. So these are people on email who have been out there talking, you know, trying to assist the nurses, support the hospitals. But again, as Andrew and a number of other people have said, this is about the board. And I think, Angela, what we need probably is for a small group of people to come together and request to attend a board meeting and push Bill, the chair of the board, and the board members who are basically, in my opinion, and this is just my opinion, who have been muzzled. You hear nothing from the members in Chesley. You hear nothing from the members in Paisley. There's a new board member for Walkerton who no one seems to have heard anything from. And it's my understanding that what's happened is that the board chair is controlling this board, and they're allowing Michael Barrett to continue to do what he's doing. I have been told that the agencies are charging upwards of $160 an hour plus accommodations up here and transportation. There are nurses coming up here from Toronto where our own staff have been asked to drive to the hotel and pick the staff up because it's snowing and they can't get access to taxis.
Thank you.
So this is the kind of absurd behavior that's going on up here. And yet our nurses continue to be professional. They continue to do whatever they need to do to provide the best care. My daughter was at the hospital yesterday with my granddaughter in Walkerton, and the Emerge had 10 to 15 people waiting to be triaged. It's absolutely full right now with small children. And I'm sure the staff are at their wits' end. So I think we have written to the Southwest Ontario Health person, Susan, I forget her last name. A number of times people have written her, and we've gotten back letters that are basically foolishness, you know, poo-pooing the situation. I think there has been attempts to get the new member of parliament, provincial parliament from Owen Sound, we understand was handpicked by Doug Ford. So I don't buy that he's green. I buy that he's there and he's pretending he doesn't know what he's doing, but he got put in there by the premier. And the problem is the Minister of Health knew about all of this. We've been asking for a supervisor for 6 months for the Minister of Health to appoint a supervisor to come in and take over the hospital, all 4 sites, take over the board, take over the management, and fix the problems, because we have nurses that want to work here and they're not being allowed to work here. They can't work under these circumstances.
Carol, do you know how to have a contact information for the Friends of the Chesley and Walkerton hospitals?
I do. I have information I can share with you, Ross, and Angela, if you guys want to put your email addresses there.
If it's public and putting it in the chat would mean anyone else could contact them too, if it's public. If not, yeah, please send it to us.
I'm not sure if Greg McLean is still the lead on the Walkerton and Chesley. He's just been newly elected onto council, so I'm not sure if he stepped down or not. But there's Darren and there's a number of folks actually on this call tonight who are part of that. Sharon, you're here. There's a number of very active people from the Chesley Walkerton group. The Kincardine group, I can reach out to them and also have them, but I think it'd be a great opportunity to do another call, maybe with a smaller group, and try to get to some strategies. But we believe, despite the concerns about bringing a supervisor in. We don't believe that they're meeting their accountabilities and the board and the hospital are not doing what they're supposed to be doing.
Mhm.
And that the only hope, because the board chair has stood up at the last Chesley meeting, October 18th, and said he supports Michael Barrett, the CEO, 100%, as does the board, and that they're okay with everything that's going on.
Right. Thank you. Okay, Bryn?
Yes, thank you. Just to follow up on a couple of things. I am currently listed as happily retired, but before I retired, I was a community organizer with CUPE. And I'd be very interested, Angela, if you, maybe I can send you an email, you and I could maybe chat. I might be able to join in and help in some way. In fact, I think when I was there, I did represent on OHC.
Bryn,
The
could you
board.
send
Someone stood up at the
the,
meeting and said, how do you get on this board? And the chair of the board described this absolutely tight system. People apply and then they're interviewed by the board and they're asked questions, and then their questions are evaluated and they're appointed. And I'm wondering, are they really being evaluated for what they can contribute at the board level or for compliance? Because it's a closed system, who knows? And so I agree. I think that that's an issue that really needs to be addressed. Thank you for, I think it was Leanne that brought up Nathan, and Andrew also mentioned him. I know Nathan quite well, and I will be in touch. His mother, remember going back to my mother writing letters, his mother was one of my mother's best friends. So the two families know each other. Anyways, I'd love to get involved, and I've
Bryn,
got some names and phone numbers.
Great.
I'm gonna find a way. They can.
Bryn, would you mind
Oh,
sending your contact information to Riley at OHC
To
at
Riley,
simpatico.ca? Send it to the email address. It's in the chat. There's OHC at simpatico.ca.
thank you
Or
very
you-
much.
Yeah, that would be great. Then we would know how to get hold of it. Is there anybody else on who would like to say something, ask a question, make a comment, who hasn't had a chance yet? You know, this has been, for me, a wonderful conversation. I have learned an awful lot. And I think that, you know, the community there sounds like they're doing lots. But we're very happy to help any way we can. You know, the Ontario Health Coalition is an organization of labor and community groups. We have 400 member organizations with people all across the province, and we will do what we can to help you, and in any way that we can. And part of it is the provincial campaign, because we know that that's where a lot of this starts, but also there are very specific problems. And having unresponsive hospital boards or local boards is not uncommon. And it does take a little bit of jiggling to loosen that. It's been a fight we've been having for years about accountability in the healthcare system. And unfortunately, as we've gotten into the funding crisis and the beds crisis, we've also gotten deeper and deeper into the lack of accountability crisis. So it's part of the ball of wax here, but it's good to start working on our local hospitals to do it. So I want to thank everybody. I still three hands up. If you've got a very quick comment, I don't know if you still do, that would be great. Otherwise, I think we probably should move on. Leanna, did you still want to make something, a comment?
Yes, Brenda, you can reach out to Doug Walsh too. He also fought to keep
Oh,
the
yeah,
Chesley
Doug.
Hospital open in the 90s.
Yes.
Okay,
Mr.
great, thank
Walsh
you.
will go to bat with you.
Great,
Yep.
thank you. And Brenda, I got your stuff there. You put it in. That's wonderful. Thanks very much. Okay, everybody, thank you very much for coming. It's been a great conversation. I really wish you the best of luck with your emergency room there and keeping those hospitals alive and well. Okay, thanks, everyone.
He's from
Thank
near.
you.
And feel free to send us an email on the OHC site and participate in the campaign. Thank you.